A very good morning to one and all present here. I'm going to be presenting about a reflex pathway which regulates blood pressure within seconds. That is the baroreceptor reflex. So, what is blood pressure? Blood pressure is the lateral pressure exerted by the blood on the walls of the arteries. Now, blood pressure can be expressed as cardiac output times the peripheral resistance. So, with changes with cardiac output and the peripheral resistance, the blood pressure is also going to change. But in order to maintain homeostasis in the body, there are several regulatory pathways which is going to operate, like the short term regulation, which occurs by the reflex regulation, which includes your baroreceptor reflex, chemoreceptor reflex, Cushing and Bainbridge reflex, and so on. And the intermediate reflex, which occurs mainly through the vascular mechanisms. And for example, the RAS pathway or the renin angiotensin aldosterone pathway, and the long term regulation, which occurs by the principle of pressure diuresis in your kidneys. Now let's look at the main short term regulation, which is a baroreceptor reflex or the sino-aortic reflex. This occurs within seconds as it is a short term reflex and an example of negative feedback mechanism. The components of any reflex arc, as you all know, it starts from the stimulus followed by the receptor. Here it is the baroreceptor, sensed by the sensory afferents, the cranial nerve 9 and 10, and the center, which is the medulla here, and the efferent path, followed by the efferent pathway, which includes changes in your SNS and PNS, finally producing the desired outcome or response. Starting with the baroreceptor, I told you it is also known as the sino-aortic pathway because of the location of baroreceptors in your carotid sinus and your aortic arch. Aortic arch is the part, it's the second part of aorta, and as we all know, and the carotid sinus is nothing but the initial dilated portion of the internal carotid artery just after the bifurcation of the common carotid artery. They are also known, they are basically stretch receptors which stretches on increased pressure, which causes distension of your carotid sinus and aortic arch. This helps in regulating blood pressure in the range of 70 to 150 millimeters of mercury. So from baroreceptors, this is going to be taken, the information is going to be carried by your sensory afferents. The sensory afferents from the arch of aorta is the vagus nerve via the science nerve, and from the carotid sinus is the glossopharyngeal nerve, cranial nerve number 9, which occurs via the Herring's nerve. These nerves are also known as the sinus nerves or buffer nerves, as they help in regulating the as they help in buffering the blood pressure in the body. Alright. So this will finally reach the nucleus tractus solitarius in the medulla. Now let's take an example of increased blood pressure to actually see what are the changes in blood pressure. So the medulla has two regions, vasomotor region and cardioinhibitory region. Vasomotor region has caudal region, which is vasodilatory effect, and rostral region, which has vasoconstrictory effect, and the intermediate ventrolateral medulla. And the cardiac inhibitory region has the nucleus tractus solitarius, the nucleus ambiguus, and the dorsal motor neuron of the vagus. Now let's take an example of increased blood pressure to see what is actually happening. So it is going to be sensed by your carotid receptors and aortic arch receptors, taken up by the cranial nerves 9 and 10, and finally reaches the nucleus tractus solitarius. Nucleus tractus solitarius will activate your caudal ventrolateral medulla by the neurotransmitter glutamate, which in turn inhibits the rostral ventrolateral medulla by the neurotransmitter GABA. Remember that the dorsoventrolateral medulla is a part of your SNS. So increased BP is causing a an inhibition of your SNS, and nucleus tractus solitarius also activates your nucleus ambiguus, which is a part of PNS. So as a result, there are effects on three organs, that is your heart, the blood vessel, and the adrenal medulla. Okay, so let's look what are the what is happening on increased blood pressure. There is SNS inhibition and PNS activation, leading to effect on heart, there is bradycardia and decreased cardiac output, effect on blood vessels, that is vasodilation and venodilation, and effect on adrenal medulla is your decreased production of catecholamines. So this is an example of increased blood pressure. Now let's look at what is going to happen in decreased blood pressure. In decreased blood pressure, there is going to be stimulation of the sympathetic pathway and inhibition of the parasympathetic system. So stimulation of SNS will cause increased vasodilation, vasoconstriction, and venoconstriction, cardiac stimulation, and increased secretion of your catecholamines. Alright. So this pathway, the sensory efferents originate from the intermediolateral part of the spinal cord. Hence the name bulbospinal pathway. Right. Now let's look at the role of baroreceptors in our body. Baroreceptors serves as life-saving mechanism in our body. This is especially noted when we get up immediately from the supine position. There is venous pooling and decreased blood flow, causing this is almost 15% of acute hemorrhage, which can even lead to shock in case of absence of your baroreceptor reflex. This hence it serves as a protective function. In patients of postural or orthostatic hypotension, what happens is when they get up from supine position, they feel drowsy and dizzy. Okay, so this is because baroreceptor reflex are not functioning properly. The second one is in chronic hypertensive people, in which there is decreased there is a baroreceptor resetting happening. So what happens in them is even when the pressure is so high, for example say 190 mm of Hg, your baroreceptors are not going to sense it as a high pressure and immediately cause a low pressure. Okay, that is not normalizing the BP. The BP is still going to remain high, and this is to allow your baroreceptors to operate a wider range of blood pressure. So these are the two clinical applications related to baroreceptor pathway. So now this is the basic summary of the entire baroreceptor pathway. So increased blood pressure is going to cause decreased firing of the baroreceptors, and it is going to increase your PNS stimulation and decrease your SNS stimulation, and the reverse is going to happen in when the blood pressure decreases. So these are my references. Thank you so much.